Hey, my name is Jen. I am a film podcaster and writer. Normally, I'd be here recommending a film that I think you might want to check out that you have missed, and I hope to do that soon, of course. But today I'm here for a different reason altogether, something that came up in messages that I received. I had some listeners and readers who knew I was dealing with a bad autoimmune flare and really increased chronic pain, wondering how I deal with pain and how they can maybe deal a little bit better with chronic pain in their lives too, because they knew that I've dealt with it for 33 years. I've had chronic pain every day since I was 11 years old. I had scoliosis, five major spinal fusion surgeries, autoimmune issues, genetic disorder issues, all kinds of things. And I am pretty tough. I deal with on a whole like 5 out of 10 or 6 out of 10 is my average for the pain threshold that I just call my normal essentially, and I'm good with that. But recently I've been in an autoimmune flare where I keep hitting 10 out of 10. There's new joint involvement and it's been getting worse, so it's kind of slowing down my output a little bit while I'm hopefully getting on a good treatment program for it. And I've been very open about that because my podcast is Patreon supported, and I don't want people to feel like I'm shortchanging them or something because I'm going on hiatus for a couple months. I've got enough shows kind of in backlog that you will hear. And in speaking out and saying this is going on, I started to hear from people, including a young woman who is about half my age, who just got diagnosed with something herself and is overwhelmed and wanted to know what she could do on her own to kind of mitigate that and take care of pain. I'm not here to talk to you about like concrete medical advice and medications and like surgeries and that kind of thing. That is between you and your doctor. You know your body best. Always listen to that. You are your own best advocate. But if any of these things, any of these modalities will help you, and I did not share that, I would feel bad because pain is the worst. And I'm in a horrible flare right now, and I like to keep busy and try to help other people. So that's what I'm here to do. I have plenty of props, so hopefully you'll enjoy this a little bit. Okay, the first thing you want to do when you have chronic pain is think about your clothes. It sounds strange, but tight jeans and things that are like if you have a knee problem, skinny jeans. First of all, I'm over skinny jeans, especially on dudes. Let's get rid of skinny jeans. But skinny jeans are kind of the enemy of inflammation and knee problems and hip problems. And, think about what you're wearing, what's comfortable. I wear a million dresses, and it's kind of funny. People always ask me about my dresses, like, oh, Jen, you're so dressed up. Okay, I enjoy dresses, and I do think that, it shows respect for myself and for other people. And I was kind of raised that way. And I do enjoy it, but the real reason that I wear so many dresses is because it's the most comfortable thing that I own. When you deal with like chronic spine issues, being able to just slide into a dress, go about your day, especially when you live in Phoenix and it's super hot, is extremely helpful. So think about the clothes you're wearing. Anything that's too tight or uncomfortable is doing you a disservice. Also, if you have gut issues, you don't want your jeans too tight. So think about that first. Also, do not be afraid of assistive devices. I will say, without turning this into like a therapy session, that I've had a bad experience over the years with like men being jerks about needing to use a cane occasionally, like when I had a really bad flare, or if I need to like wear a wrist brace when I'm typing or whatever it is. I've heard about it and I've gotten some comments like, oh, and so don't let anybody prevent you from using whatever devices might help you. Cushions are great. I love back cushions, seat cushions. anything like that. It's really funny. At my job that I work at part-time, I brought a little back cushion, backrest for the computer chair. And one of my coworkers didn't know what it was, thought at first, like, do you have a back brace? And then sat in the same chair. And now it just like lives at my workplace. This back cushion that I think I got like for 20 bucks at Amazon is now everybody's favorite back cushion. So don't be afraid of assistive devices. They can help people. And who knows, maybe your friends or people in your lives will appreciate them as well. Also, if you need, like I said, little wrist guards occasionally, if you're in a flare up, or a neck brace, if you tweak your neck or do something, like whatever it is, don't be afraid. Anyone who's a jerk about things really shouldn't be in your life. And if they're making jokes or doing things like weird impressions of people with walkers or something like that, be on the lookout. These are not the right people for you. Just, put yourself first and look after your health because it's your body and you should come first for sure. Also, there's a lot of really cool canes and things, some with flowers. I think it was Selma Blair had like a cane for her MS that was clear, which is really cool in case you're like self-conscious about walking with one. It can be clear when you need it, that kind of thing. Also, ice. It sounds pretty obvious, but I think a lot of people might forget how good an ice pack can be. Bag of frozen peas, of course, wrapped in a towel. Don't like put these right on your skin. That would be bad. But ice packs, if you're far from the kitchen in the middle of the night or something, use like a little cooler, put it in your room and have a couple ice packs in there, something like that would help. Or if you have a little, mini fridge or whatever it is, if it's a couple story house, that kind of thing. The things I recommend the most that I've turned a lot of people onto over the years are these over-the-counter lidocaine patches. There are generic versions of these that work very well, but I think the best ones are still these salon paws. These are 4% prescription. You can get like a 5%, but most insurance won't cover it now because these are over the counter. They are a little bit pricey, I do have to say. So if you want to try the generics first and see if they work, you put on a patch wherever it hurts, like your back. Knee is kind of a tricky area because if you're wearing pants or something, it might pull off. And they last about like 6 hours. It's another thing, especially when you're traveling and sleeping at night where you can't have an ice pack in a hotel. Salon Paws works very well for that. The other thing is the Aspercreme people make a roll-on of lidocaine that you can roll on like your elbows or your knees or wherever it is hurting that day. Funny story about this. This has lavender in it. For whatever reason, whenever I was in LA and I had this on, people would be like, "What are you wearing? What is that scent?" Oh my gosh, I got into an elevator and I wasn't even thinking about it. This woman like, "Oh my gosh, I love your fragrance. What is it?" And I told her what I thought it was, my perfume, and she said, "Yeah, I love lavender." And then walked away and I realized she was talking about Aspercreme. So this smells good, you guys. That's all I'm going to say. So there might be a perk there for you. Another thing that you can now get Amazon or over the counter, I think they have them right in the aisle at Walgreens, are these things called TENS units. And TENS as in TENS. These are not as good as the ones you will get at physical therapy. Those are like IFC units or, much more intensive, couple $100s. I mean, you can order them. I did have one at one point, but it died and it was like way too expensive to replace. But these TENS units work pretty well. What you do is you get electrodes and you follow the little instructions. It's kind of like playing tic-tac-toe essentially around the area that it hurts. Put it on, and you can adjust the intensity of whatever the massage or whatever the mode is to interrupt the nerves or stimulate that area. You know your body well. You want to be able to feel it, but you don't want it to hurt, is the trick. So I would say these are good. I think it lasts for like 15, maybe 30 minutes. You can do them, I believe, twice a day, which is a very good thing to have. It's a nice little, like, when nothing else is working, try something like that, for example. Another thing, a lot of insurances now with physical therapy, they're not covering it, or the copay is so outrageous that you're not able to go as many times as you would like. I'm going to tell you a little workaround. I personally, everybody's different. I am not a chiropractor person. I think because I've had so many spinal fusion surgeries, like it's just, that's not a good idea. I love physical therapy. I think it's a very good thing. But I've been going since I was 11, so like this is not my first rodeo. I actually babysat for my physical therapist growing up. And she kind of advised me over the years, like, you know your body, you know how to do things. Get a book because I was one of those bookish nerds, like from childhood on. So you can actually buy the American Physical Therapy Association book of body maintenance and repair. Guys, it has like pictures of exercises and things you do. I mean, I have marked, look at this, so many things over the years. And, don't overdo it. Go at your own pace. Start slowly. I do recommend like getting seen by an actual physical therapist so you know what you're doing. But then, if you can only afford a couple sessions, start incorporating other things that, you see and might work. Other things you can do are go for a walk if that is something, like start slowly. Swimming is great because you're not really putting a lot of weight or pressure on your body. So swimming is a really good thing. Some people recommend like hot tubs and that kind of thing. Other people don't. There's also an issue with like climbing in and getting into these things that might cause more pain for somebody with like MS or something else. So do be conscious of what you have and what works for you. No two people are the same. Everybody's going to react to something differently. When it comes to physical therapy, good things you can do are use like these resistance bands. However, when you're using, your arms or um, you can tie them onto doorknobs, whatever it is. So resistance bands are very good. There's all kinds of massage things that you can get on Amazon. In addition to the TENS unit and the IFC unit, this is a little crazy, but there's also, or there was, an ultrasound you can buy. Because at physical therapy, one of the things that they were using for a while was an ultrasound machine. Not to like read and do like a test, but because the ultrasound waves were supposed to help inflammation. And so I had a physical therapist find me one on Amazon and actually recommend like, hey, just buy it and get it. And I was in so much pain at the time. I was getting diagnosed with stuff where they weren't sure what was going on. And so I got it and it did help a little bit. She's like, yeah, just buy the gel and, try it out. And it worked well. So there's different things that you can try and do, whatever works for you. Something that is inexpensive. Some people use tennis balls, but I actually found this ball. It's kind of like, I don't know, a small, some people have used golf balls, tennis balls, different ones, different sizes. And you can put it under your foot, like the plantar fascia, if you need to, massage that area. You can use it in your knees. You can use it in different places. So they make little things like that. You can try a tennis ball. You can try any kind of things that work for you. Also, be conscious of how you're sitting and how you're walking, how you're getting up, and how you get in cars. These things sound a little dumb, but think about what hurts when I get into a car. Do I have to get in a certain way? Listen to your body is what I'm saying, because that might make a difference. I was taught different ways of sitting. I kind of have to sit straight. People are always going on about my posture. Guys, it's like the spinal fusion, the rods in my back. Like I'm that straight. I'm not just walking around with a book on my head or something like that. That is just how I sit. But at the same time, you can support yourself different ways, like make sure your shoulders go back. You can use pillows, like I was saying about back cushions and seat cushions. A trick that a few different doctors told me about was like getting a phone book, if they still have phone books wherever you are, or a thick book like an encyclopedia, put it on the floor in front of you on, when you're working on your computer desk or whatever, and put your feet on it. You don't want a really high stool, but like a phone book or an encyclopedia, something like that, there's something about the way that your hips align when your feet are a little bit up that helps, I guess. They were recommending that. Also, like I said, a pillow behind me and a trick that was really strange, but it was kind of helpful. And I've used it when I've been like needing to get a paper out or I was on deadline and I had to sit in front of a computer for very long and I was in a lot of pain, is using a pillow. This is way too thick, but you can put it this way and put your arms over you. So it kind of pushes you back a little bit as you type. And it sounds kind of crazy, but I think with the phone book and with the pillow and, a back cushion, it just supports you a little more. But again, listen to your body because not everyone is going to respond to all of these things. So overall, those are some of the things I use. In addition to ice, of course, you can use heat. I am someone because I have a lot of inflammation. I'm a big ice person. I've used heat for like some sore muscles and stuff, but also I live in Phoenix, so heat isn't really my friend. So, whatever works best for you. Again, I'm not here to talk about surgeries, corrective procedures, injections, or medications. That is between you and your doctor. But these were some ideas that I wanted to share, especially because I was asked, how do you cope? Someone just got diagnosed with RA, and I wanted to see what I could do to maybe alleviate some of the pain because it's no fun. Yeah, but then again, we're tougher than your average bear. Kind of sucks that we have to be, but you know, what are you going to do? So I hope this was helpful, and I'll be back with more movie talk soon. Bye.